Hello there, ladies and gentlemen, and welcome to this special program, Get the Facts Correct, with me, Edmond Elime. And in today's edition, we shall be discussing something very, very important, and that is dementia. And we have a very powerful resource person in the house today, who is no other person but Dr. Shalini Chhabra. And Dr. Shalini Chhabra is an internist and, of course, a certified geriatrician based in the United States of America. Dr. Shalini, we are very happy to have you in today's edition of Get the Facts Correct, as you are ready to give us some basic knowledge as far as dementia is concerned. And we shall have a very first question for you, doctor, and that is going to be making a difference between the normal age process and, of course, the situation of dementia. A lot of people get it confused, where they start seeing situations like somebody exhibiting forgetfulness, a situation of forgetfulness. They tend to qualify that as the person exhibiting signs and symptoms of dementia. You might want to make us understand, or let us understand, the difference between the normal aging process and dementia, doctor.
Dementia is not normal aging. A lot of people think that, oh, I'm forgetting things, and that's a part of aging. Dementia is very different from regular aging. You can think of dementia as, you can say, I forgot my keys, I keep forgetting my keys all the time. But along with normal forgetfulness, there is also some cognitive decline or functional decline. So they cannot do their regular activities. They cannot, for example, they get lost when they're driving. So that is not normal aging. So dementia is a little more than just forgetting things. A significant cognitive decline along with forgetting things.
Thank you for that brilliant response there, doctor. We will be asking you another very important question. You are based in the United States of America. How many people are affected by dementia in the United States of America, where you are based, doctor?
In America, there are 5.5 million people who are affected by dementia. And this does not include the family members and the caregivers of the people who are actually taking care of their loved ones. It's a progressive illness and gets worse and takes a toll even on the family members. Initially, they begin with forgetfulness. Initially, they begin with, I cannot remember this and I cannot remember them. And later on, it progresses to the point that they start forgetting things which are important in their lives, forgetting their appointments, forgetting to do their regular activities. For example, they would go every day to do some shopping, or they would do every day to the gym, which they start forgetting. As it progresses, they can even not remember who and how they're related to their loved ones, which is very painful for their family members. It's kind of interesting and sad to see that you can even see people who have been married for 50 years with the onset of dementia. They will not even remember their spouses of 50 years of marriage. It takes a toll on their husbands or their wives to see that their wife or their husband cannot even remember them. And they've been married for 50 plus years. They come to a point where they're almost like they have a shell around themselves. It's almost like a cocoon, and they start getting restrained or refrained because they cannot remember the people around them.
Ladies and gentlemen, that is, you can see the number of persons who have been affected just in America. Imagine us bringing you the statistics of the people affected in the world. It will be amazing. You'll be marveled how many people are affected by dementia in the entire world. Ladies and gentlemen, we shall now be going into another very, very important question. Of course, a lot of people are doubting whether dementia is treatable or not. Doctor, you might want to let us understand, is dementia treatable or not?
Currently, there is no good treatment to totally take care of it. But there are options. There are medications which slow down the progression of the disease. This helps people stay more functional at home with their family members. It can even delay, some people don't want to go to the nursing home. They want to stay at home, and it can allow them to stay at home till as late as possible. So these medications slow down the progression. And then there are some factors which we can work on helpful factors to control the progression of dementia. Things like controlling blood pressure, things like cognitive training. So if we start noticing that someone is becoming very forgetful, we start doing cognitive exercises, games, that they recall, these kind of things. Even physical activity helps a lot, to do as much exercise as they can physically do and safely do. That improves the blood circulation, not just to the heart, but also to the brain. And we do see that could have, or that may help with the dementia.
Thank you very much, Doctor, for that beautiful one as well. And now we get to understand that dementia cannot be reversed. It's not treatable. It can only be managed. So we need to be very careful as we live a life not to get into that situation of dementia. And the subsequent video, I'll be bringing you another doctor who shall be discussing what really causes dementia in the next edition of Get the Facts Correct. Ladies and gentlemen, we are gradually going to the end of the program, but we shall be asking Doctor this question, which is the last but not the least one. How important is the early diagnosis of dementia, Doctor?
The best thing would be to get diagnosed as early as possible, so that we can start the management as early as possible, so we can slow down the progress in the early stages. See your provider, see a geriatrician who can explain to you what to expect in the near future, and to try to understand this illness, not only for their caregiver, but for themselves, because a lot of it will fall on them to ultimately understand their illness and take care of them. I have seen dementia growing up, and I know how hard it is, not even only for the patient, but for the caregivers. Every time I see someone who is coming to my office, for me, that person is not a patient. For me, that person is a person who has family members who care for him or her, and I treat them as if I would treat my grandmother or my grandfather or my parent if need be. I want to make sure that they understand and they are involved in their care, and I am very much involved in their care.
Great, thank you very, very much. Ladies and gentlemen, we now see that it is very important for somebody or for any person to have a dementia diagnosed very quickly. Therefore, if we start observing signs and symptoms of dementia, it's very important that you contact your doctor to be able to identify very quickly if it is dementia, so that management can be started. Ladies and gentlemen, thank you very much for having been in this program today, Dr. Shalini. We might be having you again some other time. And thank you for all the viewers who have been here to listen. I urge you to share this video so that somebody will learn something as far as dementia is concerned. Until some other time, when we shall be bringing you another edition of Get the Facts Correct. My name remains Edman Elime, alias Eddie Bobo. Ciao.